Hey guys, welcome back to my channel. I'm back with another video. I told you guys in the last video that I was going to do this little series, I guess you can call it, of 3 things that I learned while in Med Tele. And the reason I'm doing this video is because there's not a lot out there, about Med Tele other than people saying don't go into it. Like, go straight into what you want to do. And I'm an advocate for go straight into what you want to do. Don't get me wrong. However, I feel like there needs to be more support for the Med Tele nurses like myself. Because Med Tele is hard work. It's very, very hard work. But you do learn a whole lot. Like, you learn a whole lot when it comes to Med Tele. And I wouldn't trade what I've learned in these last 3 months to go into the specialty that I wanted to go into right away. Like, I wouldn't trade it because that specialty will always be there. And for those of you who don't really know what you want to do, like Med Tele, Med Surg, it's a good field to start in. It really is. So, and before I start, I just want to say today was a great day. I went to the Nurse Link Nurse Expo today in Orlando. I got to meet my favorite nurse, or my favorite YouTube nurse anyway. Her name is Alexis, and her brand is the Nurse Nook. I love her. She's great. Found out we went to the same university at the same time. We've actually crossed paths before, but I guess I couldn't put 2 and 2 together. I didn't remember. But then, we started talking or whatever, and I was like, oh, okay, so that's cool. Yeah, and I'm actually going to show you guys a little clip. This little clip is from the Nurse Link. I really hope not the Nurse Link, I'm so sorry. This little clip is from Novice the New Nurse. Novice is the new nurse. Let me slow down. Novice is the new nurse. I just recorded this little bit on my phone, so don't mind the quality. It's not the greatest, but without further ado, here is the clip.
A big thing that I like to teach people about their anxiety. Your anxiety is always wrapped around your insecurity, right? And so when you step onto your unit, whenever you feel the flutters get even more, whatever's happening in that moment, that's like an indicator of what you're most insecure about. When you figure out that thing that you're most insecure about, then that's the thing you need to go focus on and practice and work on. So if I'm insecure about breath sounds because I get nervous when they told me to go listen to those breath sounds, then I need to get on YouTube and start listening to breath sounds. I need to ask everybody on the unit, can I listen to your patient's breath sounds? Right? Like, what if it's someone says go update the doctor, and you find yourself getting extra nervous? Well, that means you're insecure about communicating with the physician. So now you need to go practice how you're going to update the physician. So there's so many ways that you can like ease those jitters, but it's not just a you're going to be okay process. It's like an active do the work type of thing. And it starts with like just figuring out who you are first and foremost, and then branching off.
Okay. So, I hope you guys enjoyed that. I would suggest for all the new nurses who just graduated, who feel any type of stress or anxiety or whatever, really consider going and doing her program. She's great. Like, she's so great. But anyways, on to my content, which is 3 things that I learned while in Med Tele. And if it seems like I'm speeding, it's because I am. The sun is about to go down, so this natural lighting thing is about to be gone, and y'all, I got the grease face. It's just so much going on, but let me stop rambling. So first thing that I learned is patients will fake seizures. And I bet you like, well, why would they want to do that? The reason they will fake seizures is because if they're in a situation that they don't want to be in, and the hospital is a way for them to get out of it, they will fake seizures to stay in the hospital. And they will fake a whole host of other things, chest pain, everything, when they don't want to go back to their situations. Now, I'm going to let you use your imagination on what you think that situation is. Yeah. So anyway, but one of the ways that you can tell if a patient is faking a seizure is if they respond to risk of threat. Now, on the unit, we don't say risk of threat because we don't want them to like know that we know what they're doing. We'll say ROT, but that's funny, rot. But yeah, so basically, if you have a patient and they're seizing, and they not seizing for real, or if you ask them questions and they respond coherently, like you ask them, "Are you in any pain?" and they manage to mumble yes, thinking that it's going to further prove that they're seizing. Like, when have you known a person seizing to respond? I wait. Exactly, they don't. So if they respond to you, they're faking. That's just point blank period. They're faking. So anyway, the next thing that I've learned while in Med Tele is that if a patient is doing cocaine, you really want to pay attention to the drugs or the medications that they're taking while they're, in their hospital stay. So basically, if you do your drug screen and it comes back that the person is positive cocaine, you really want to make sure that like they're not on medications like carvedilol, because cocaine can cause a lot of congestion in the heart, and then with the carvedilol really trying to get that heart to pump, it really, it's just too much on the heart. Now, I don't know the full science behind it. I'm just telling you guys what I've learned in this brief day that it has happened to me. But yeah, you want to make sure, you want to like cross reference their medications, or even if you don't know, like bring it up to the pharmacist, like, hey, my patient tested positive for X, Y, or Z. Like, is there anything that's really contraindicated that that we commonly give that I should look out for? It's something to think about. The last thing that I've learned, which is so important, I'm gonna take my glasses off for this one because the glare is really getting you, girl. Last thing I've learned is you cannot do it all by yourself. I know you wanna like prove to yourself that you are a great nurse and that you can handle it and you are just as good and just as valuable as the next nurse. But the thing is, the next nurse got 10 years of experience, and it doesn't make you less valuable. It does not. However, you don't have the same skills that she has. You don't. And that's okay. And you'll get those skills in time. Hold on. Oh, excuse me, y'all. I just didn't eat today, so I'm really gassy. I'm really sorry. I'm sorry. I'm keeping it real. I mean, like, it's like the upper gas, not the lower gas. But whatever. The lower gas would be much better because then I could just let it out and be free. But the upper gas, it get right here in your chest. Ugh. But anyway, let me get back to it. You don't have the same skill set that she has, and that is okay. It does not make you less valuable. But what is valuable, or what skill set that you do need to have, is being able to delegate and being able to know when you need help and when to ask for help. Like, for me this week, I learned that about myself, that I don't like to ask for help, and when I really need it. So now I'm in a room with a patient who's basically faking a seizure, and then my next patient down the hall is, or next door over, is having chest pain, and I'm trying to manage this while I have three other patients that I have not gone and seen. One patient has a heparin drip, and another patient, she just told me, hey, my stool sample's ready, and I'm trying to handle it all on my own, and it's all happening all at once. And I got really behind, y'all. I got really behind, and my patient, like, I didn't get to see one of my patients till 11 o'clock, and that's not okay. That no one's seen this patient from 7 to 11 for 4 hours. That's not okay. I didn't even do vitals on the patient. Like, that's not okay, and that was on me. And I'm not even gonna be that hard on myself because I'm a new nurse. So I'm not gonna beat myself up about the fact that, okay, I didn't do well with delegation today. I didn't do well with time management today. But it just gives me in the mind frame to know that the next time that I go back, I will do better at it. Like, I will. So guys, I hope you enjoyed this video. I hope you subscribe if you watch me and you like me, whatever. And to the subscriber that I saw today, I'm so shocked. Like, honestly, I know that I have like 98 subscribers now, and which means 98 people in the world who watch my stuff, but it still shocks me that people I don't know me. And I'm a really friendly person, so if you meet me in person, please talk to me. Like, I'm gonna tell y'all the way I met my best friend. This is how friendly I am. Real quick story, and then I'm done. We were in college, and I lost my ID card, and I went back to backtrack for it, and I saw her walking by herself, And I walked up to her and I said, "Hey, have you seen the ID card anywhere?" And she was like, "No." And she looked at me all weird. And I was like, "Oh, well, where you going?" And she was like, "To CVS." And I was like, "Okay, I'm gonna go with you." And now she's my best friend. So that's how friendly I am. Like, I'm really like a friendly person, and I love to meet new people. I love, love, love to make new friends. So if you see me, please talk to me. Like, I ain't nobody to be all big and like all high and mighty. Like, get in line and take a picture with me. Absolutely not. Like, I'd be like, "Girl, let's go get lunch. Let's go eat. Let's go talk. You tell me about your story, and let's share experiences." So with that being said, I'm gonna go because I bought me some Boston Market and it's bussing. Like, I'm sorry that the ratchetness had to come out of me, y'all, but it's bussin', it's fire, it's delicious. And I'm about to go eat it. And I hope you guys have a wonderful day. And at the next Nursing Expo, maybe I might be one of the speakers if I get enough subscribers, you know. But if not, then whatever. I'm good with just sitting in the crowd and getting my questions answered. Anyway, yeah, I gotta go. Bye.